Hello, I'm Dr. Teresa Marquez-Smith. I'm in solo practice in El Paso, Texas. And I wanted to talk to you a little bit about the Immunocap and how I use it in my practice. I've been using it now for about maybe 3 years, and I have found it very useful. First of all, I see about maybe 40 to 50 patients a day, and that's on average. And many of them come in with chronic symptoms of asthma, allergy, as well as eczema. Usually what happens is the parent comes in and they come in complaining of certain symptoms, and I determine whether they have any atopy. Sometimes the parent comes in with all these symptoms and they actually have in the past requested the test themselves. The test is becoming a little bit more widely used, and so now parents are hearing about it and they want their child tested. And the majority of them don't really want to do the skin prick test because they feel that it's more traumatic for their child. And so once they come in and I discuss the iCap, which is just a quick, we draw the blood here, we send it to the lab, we bring them in for follow-up in 2 weeks and give them results. And it actually is a very, very easy process for the parent. The reason that I like the test is, first of all, it empowers the parent, because the parent can then know specifically what they're allergic to, and avoidance, of course, which is very key in the treatment of asthma as well as allergies and eczema. The parent can then avoid certain situations or pre-treat, and so that is why I really like empowering the parent and them knowing specifically what their child is allergic to. The second way that it has helped me, and this is very important to me, it keeps my patients in-house. Whereas before I used to refer the allergist almost on a daily basis. Now I refer only those very difficult cases to the allergist as well as to the pulmonologist. And so for me, it has worked out very well, because instead of sending the patient off and having them treated somewhere else, I initially see them, then I see them for follow-up, and then I see them every 3 or 4 months for refills. And that has increased revenue for me. And if that is important, well, I think it's important for every pediatrician or physician in general to increase revenue, especially in these difficult times. But that is the way that I have used the test, and I really like the fact that I keep my patients in-house. Before, I used to send the patient to the specialist and I would lose track of them. And now I primarily keep them here, and my referral rate is very low, which is another thing that you have to consider, because insurances look at your referral rate. So that is the way that that test has helped me.
Thank you. Any additional comments?
I think that's it.
Thank you.